Welcome to the SASH Preparing for Your Postnatal Stay webinar. This webinar is pre-recorded. If you have any questions throughout the webinar, please post them into the chat box and the facilitator will run through these questions at the end of the presentation. Throughout this presentation, we will be using the term mother and the pronouns she, her, but this does not detract from the knowledge that some may use differing pronouns throughout their birthing journey. It would be really beneficial for us to learn what you would like to gain from today's webinar. So please would you take a moment to write any of these points into the chat box alongside how many weeks pregnant you or your partner are. As this session is pre-recorded, we cannot see if you raise your hand to ask a question, so please only do this at the end once the facilitator has paused or stopped the pre-recording. This slide shows all the topics we are going to cover throughout the webinar. We will start with reasons for your stay, support for you and your maternity team, visiting on Burstow ward, the ward environment, supporters staying overnight, a day in the life on Burstow ward, keeping your baby safe, infant feeding, although this is covered in more depth in our specific infant feeding webinar, having a baby in the neonatal unit, going home, question time, and we'd really appreciate your feedback at the end. There are a multitude of different reasons for staying on the postnatal ward, including staying overnight. Some mothers and babies require extra feeding support, for example, first-time mothers, those with previous feeding challenges, those with smaller or preterm premature babies, or those babies at risk of hypoglycemia, which means babies dropping their blood sugars. Some mothers may have an individualised birth plan and postnatal plan. For example, there may be some reasons for extra mental health support. The type of birth may determine your length of stay as well. This could be an uncomplicated caesarean ventouse forceps birth requires a 24-hour minimum stay. This could also require a longer stay depending on individual circumstances. And medical reasons may impact the length of stay to ensure patient safety once discharged home. Some babies require extra observations, for example, those born to diabetic mothers or those at risk of infection. Additionally, it may just be personal choice that you would like to stay on the ward with extra support for a few days or more, and that is absolutely fine. We can facilitate that. Anything that you require, we can work and build a personalised plan for you. There is lots of different support available for you on Burstow ward. Here on this wheel you can see there are a multitude of differing members of staff that you may meet during your stay. You may not come across all of them, but you will definitely meet at least some. So we have midwives, maternity support workers, nurses, hearing screeners, ward clerks, volunteers, housekeepers and hostesses, doctors, the infant feeding team, and also students. With all those different members of staff, they will often be wearing a different colour uniform. So on this slide, you can see those differing uniforms and what the different colours mean with regards to different members of the team. We have ranging colours, with our midwives particularly being in blues, greens and purples. Our student midwives are often in white, but sometimes they wear scrubs, which can be that blue or pink colour, and sometimes they have a purple colour on as well. All of our student midwives should wear lanyards to state which year of their degree they are in, first, second or third year, and they are always working alongside members of the team. And if they are working to see you on their own, that's because they are of a seniority that allows them to do so, and they have their full training. So please do not be worried, our students are a valuable member of our team. Visiting on Burstow ward is one of the most popular questions we receive. Each mother may have 2 nominated birth partners who are there to offer her support, and that is through the birth and also during the postnatal period. These 2 people may visit from 8 AM until 8 PM, and one of these birth support partners may stay overnight to provide support if required. All other friends and family may visit from 4 until 8 PM, and children of the mother only may visit from 4 till 6 PM. Please we ask that no more than 2 adult visitors are at the bedside at any one time due to the space at the bedside and the requirement to enhance safety in those small spaces. These visiting times are in place for the safety of women and babies on the ward, so that important tasks and reviews may also be performed safely and meal times are not interrupted. Quiet time is between 1 p.m. and 3 p.m. Birth partners are welcome to stay in this time, but please do limit moving around the ward, entering and exiting the ward, and keep noise to a minimum. If you would like earplugs and an eye mask, please simply ask a member of staff to provide these for you. The birth partner staying overnight is entitled to free parking for a 24-hour period. The second birth partner is entitled to a £4 pass for a 24-hour period. Please ask a member of staff or our ward clerk at the desk to input your registration into the system before you leave. All other visitors are required to pay at the parking machines at the standard rate upon exit. Within the Burstow ward environment, we have 28 beds and cots, and these consist of 4 6-bedded bays and 4 side rooms. Our side rooms are provided on clinical need in the first instance, for example, any infection, mothers separated from their babies due to neonatal care requirements or individualised care plans. If not being used for clinical reasons, these side rooms may be provided as an amenity and therefore a paid-for room. Room 1, which has an ensuite, is £120 per night, and the other 3 rooms are at £80 per night. These other 3 rooms utilised the shared bathrooms within the ward. There are 4 patient toilets on the ward, and 3 of these have shower facilities. The visitors' toilets are located off of the ward. Unfortunately, we do not have a large enough floor plan at this time to have a visitor toilet based on the ward, and we are also unable to offer visitor shower facilities. Due to the size of the ward and the high daily activity, we recognise that the ward can be a noisy environment. As already mentioned, we have quiet time between 1 p.m. and 3 p.m, where we ask for only the 2 birth partners to be at the bed space as visitors and to have minimal entering and exiting the ward during this time. At this time, the lights are dimmed and blinds pulled down. Clinical care and discharges will still occur during this time, but staff are mindful to do this at a quiet level. Patient feedback has asked that we ask patients to keep phone calls at all times to a minimum and to have all videos and video calls played through headphones and not on loudspeaker, please. Each patient's experience is different to the next person, and some may require more rest than others. Please also refrain from making any phone calls after 2 p.m, as lots of mothers and babies will be trying to sleep at this time. Your safety on the ward is our priority. The bed spaces are quite small, so please limit the amount of luggage you bring with you and ensure your bags are stored off of the floor when you're at your bed space. This ward is a secure ward and therefore has locked doors. Please buzz for entry and ask a member of staff to open the doors on exit. Please do not push any buttons by the doors at the exit, as this may set off the fire alarm. As staff are also providing patient care, please note that it may take a little time to open the doors for you. This is normal and not a cause for concern. Our dining room is located at the back of bays 2 and 3. All meals are served there, or you may use this space as a break from your bed space. If you are unable to get to the dining room for meals, please ask your support person to fetch these for you or a member of staff for support. Each bell has a call bell system for you to gain attention of a member of staff. Currently, we are awaiting a new system to be installed, but for the meantime, when you press your button, the call bell, a member of staff will come to the bay and ask who is calling. Please respond with your bed space, and if you are unsure, you can say "me" or your name and then ask a member of staff what bed space you are in for future reference. If you are alone and require assistance, please do use the call bell system. And if you have a support person with you and they are able, they may prefer to come to the desk and find your midwife or a member of staff themselves, rather than pressing the call bell. There are a number of notice boards throughout the ward with important information displayed, such as how to contact a member of management, up-to-date ward information, and also, and often most importantly, the Wi-Fi details. As already mentioned, one birth partner may stay with you overnight to provide support to you if the mother wishes them to do so. There are armchairs provided to rest on, and if needed we can provide blankets where available. We must ask you to please refrain from sleeping on the floor, as this can provide safety issues for staff and visitors, and in case of an emergency, this could pose a risk. We also must ask to not share the beds with your partner, as these have weight restrictions on them and may not be suitable for two adults to sit or lie on. When staying overnight, please do wear appropriate day wear clothing throughout your stay. For example, not just underwear or pajamas if you're the birth partner, at all times, and also keep shoes on when walking around the ward for your safety. Please keep noise to a minimum overnight and have your phone calls through headphones and not after 10 p.m. so you can allow the rest of the patients and people staying to rest. This slide here shows you a typical day in the life on Burstow ward. Some of these timings are approximate. The actions may not occur at exactly these times, but as near to as possible throughout the day. And please do note that if you require pain relief at any time outside of medication rounds or any food outside of meal times, please do just ask a member of staff and we will be able to help you. A medication round occurs first thing in the morning, often around 6 a.m. At 7 a.m, staff shift change occurs, and this occurs in the dining room, so there is no access to the dining room during this time. At around 8, we will do sets of patient observations, and breakfast buffet is served in the dining room. Please ensure during the morning that you complete your meal form and give this back to our housekeepers so that your lunch and dinner will be provided. An infant feeding talk occurs in the dining room, dependent on the day of the week, at 11 a.m. A further medication round at midday, followed by lunch served in the dining room, which you will have pre-ordered. At 1 o'clock, quiet time begins. This then ends at 3. At 4 o'clock, visiting opens for family, friends and siblings of the baby only. 5 o'clock, dinner is served in the dining room, which you will have pre-ordered. At 6, another medication round and the visiting of siblings ends. At 7 o'clock, the staff shift change occurs again in the dining room, so no access to there at this time. 8 o'clock, visiting of family and friends ends, and one support person may now stay overnight. At 10 p.m, a further medication round, lights out and phones on silent, please. Nighttime medication and observations occur throughout the night as required. Keeping you and your baby safe on the ward is one of our top priorities. These are some points for whilst you're on the ward of how to keep your baby safe. Please do not walk around the ward with your baby in your arms. Keep baby in the cot at all times whilst moving around the ward. Also, please take your baby with you when you go to the bathroom or to shower, or alternatively ask a member of staff to look after baby during this time. Please never leave your baby on their own at the bedside. Always have baby on their back with their feet to the bottom of the cot. Please refrain from using sleep positioners, aids, pillows, bumpers, and do not store toys in the cot. This is both in hospital and once at home. When you're in bed holding baby or you're skin to skin, please have the bed on the lowest setting with the bed sides up. We must ask you to please refrain from co-sleeping with your baby on the ward. Skin to skin is very much welcomed and encouraged. If you are feeling sleepy, please ensure a support person is nearby if you're holding your baby, or place baby back in their cot. We recognise that many families choose to co-sleep. However, in hospital, we do ask you to try to refrain from falling asleep with the baby in the bed with you. If you are wishing to co-sleep once home, please ensure you have researched this. The Lullaby Trust is a fantastic website with all resources relating to safe sleep, and you can access this following the QR code on the screen. Babies should be dressed appropriately according to environmental temperature, and this may differ during summer months. Hats may be worn in hospital and encouraged as babies are so new. However, once home, please do follow the rule, no hats in the home. The ward environment is kept warm and hats applied due to babies being so young. When home, please keep your home to approximately 16 to 80 degrees centigrade. Again, the QR code there is for the Lullaby Trust, which has all up-to-date advice and research regarding safe sleeping for babies, temperature control, and signs and symptoms of illness in the newborn. A short mention of infant feeding. Please do scan the QR code to book onto additional infant feeding sessions, which cover the topic in much deeper detail. All of our staff are trained to the same BFI standard and are able to offer you feeding support, whether this is for breastfeeding or bottle feeding. Additionally, our specialist infant feeding team offer support on the wards approximately 4 days a week, mostly Monday to Friday, but sometimes also at the weekends. The ward has facilities to store expressed breast milk in a secure milk fridge and also store any formula milk you bring. Should you decide to bottle feed your baby, please bring your own milk to hospital. The 70 millilitre bottles are ideal as they can be stored easily in our fridge. The Global Health Media Project is a brilliant charity-run website where you can watch videos to assist with feeding your baby. If you are choosing to breastfeed your baby, their video on attaching your baby at the breast is a great starting point, and they also have videos on how to express breast milk. Occasionally, some babies may need to spend some time in our neonatal unit, and we understand that this can be quite an upsetting time for parents. Our neonatal unit includes the Neonatal Intensive Care Unit, NICU, Special Care Baby Unit, SCBU, and Traditional Care, TC. If your baby or babies require care on either of the above units, you may be required to remain on Burstow ward, and we appreciate that this may be a very difficult time for you and understand that you may want to spend most of your time with your baby. We encourage you to return for your mealtimes and medication rounds where able. The neonatal team are more than happy to assist you with feeding your baby, but please do also speak to your midwife or a member of the Burstow staff if you require any further support. Where possible, we endeavour to provide you with a side room, as we understand being around other babies can be upsetting. However, unfortunately, this is not always possible. We are here to help and support you, so please do let us know if you require anything, even if this is simply a cup of tea and a chat about your baby. Going home, that exciting time. The timings of discharge can be a lengthy process with delays. There is a lot of paperwork involved for staff, and we need to ensure that all doctors, if involved, or any other member of staff, have completed their elements. We are currently working on improving the system and welcome any feedback at all if you feel that there may be an alternative way that aspects of the discharge process could be completed, so please do let us know so we can work collaboratively with you to ensure this process is sped up. Please note that you are seen often by multiple different members of the team. Sometimes they may tell you that you're discharged from their service or able to go home, but this doesn't mean that you are fully discharged from the ward and able to leave at that time. So please do wait for your midwife to give you all of your paperwork and go through all of discharge questions and answers prior to leaving. We need to ensure that the newborn examination has been completed alongside other checks before you go home. There's the newborn check, or also called the NIPE, hearing checks, daily checks, doctor reviews, feeding assessments. All of these need to be completed prior to you being able to leave. Discharge paperwork and the discharge chat also needs to be completed. If you require any medications to go home with which aren't stocked on our ward, this can take a few hours to obtain from pharmacy as well. Please do let us know if you are going to a temporary location or if you have moved or if your address or GP address has changed during your pregnancy. Once your notes have been given to you and your baby has been checked in their car seat, you are discharged. Please do bring your car seat up from the car prior to discharge, as this will speed the process up for you as well. And make sure you've looked at the manufacturer's instructions so there are no surprises once we're putting baby in them. All car seats are different and work in various different ways. It's always a good idea to test your car seat out before baby's born alongside your pram as well. Make sure you ask a member of staff to input your registration so that your car parking can be completed before you leave, and do ask us if you would like to have a photo taken of you and your baby before you leave, as the lovely couple in the image there asked us to prior to them going home. During your stay, if you feel you would like to escalate any concerns or provide positive feedback, there are different people you are able to speak to. You can speak to the midwife caring for you that day, the matron or ward manager who are available Monday to Friday. The matron of the day is available via calling the switchboard and asking them to bleep 740. The delivery suite coordinator. We also have friends and family feedback, or the PALS team. Alternatively, you could discuss with the Maternity Neonatal Voices Partnership, and you can access their details via the Surrey and Sussex website. If you have any questions, please do start posting those in the chat box, or the facilitator will have a look at the chat box and go through anything else that has been written there whilst this has been playing. And we absolutely would love to have your feedback from this session. So if you do have the time to please scan the QR code and provide the feedback from this. Equally, you can speak to the facilitator now at the end with any feedback, and they can jot that down as well. Thank you so much for listening, and really hope you have enjoyed this webinar.